Hey guys, Dr. McClimon with McClimon Chiropractic, the spinal hygiene guy. Today we're going to talk about how to eliminate and prevent low back pain. And one of the ways to do that is to actually sleep properly. People always ask me, hey, what's the best way to sleep? So let's talk about that, what's good and what's bad, okay? So you got your spine here, guys. There's 3 ways to sleep typically: side, belly, and back. All right, so the reason why the belly isn't the best position, guys, is because when you're on your belly and you have your pillow, you often end up turning your neck. So when you turn your neck, it creates torque, and that can create back pain. Not ideal. The other way is you can sleep on your back. Okay, when you sleep on your back and you have your pillow, often it creates flexion in the neck. That can create tightness in the neck down through the back. That's not great either, okay? The other thing, guys, is in the spine, we talk about that condition called subluxation. That's when the spine shifts and puts pressure on that nerve, and that affects what that nerve controls. It can create back pain. And so when you sleep, you don't want to have any extra extension. Okay, in other words, you don't want to have extra extension this way, because when you extend, it pinches the nerve. When you flex, it opens the nerve. Okay, so you want to sleep in the flex position. What that means is you want to sleep in the fetal position with your knees up. When you bring your knees up, it creates flexion. Okay, so you want to sleep on your side, okay, with a pillow that's the right height that keeps your spine nice and level, okay? Keep your spine in the most neutral position. Then you want to sleep in the fetal position. When you bring your legs up, it creates flexion in the lower back, and that's going to give you relief in your lower back. That's the best, ideal, most neutral position that won't put pressure on your nervous system. It will help to eliminate low back pain. If you continue to have low back pain, maybe you can't lay on your side because you have a shoulder problem, and you have to be on your back, make sure you don't use a large pillow, and you can put something underneath your knees to create some flexion in your lower back, which can create more opening for the nerve holes and take pressure off those discs at the lower back. That also can help you while you sleep. So hope that helps, guys. A little tip of the week, and we'll see you again soon on our next video.